My name is Sanchayeeta Mitra, and my field is otolaryngology, head and neck surgery, also known as ENT. I come from a family of lawyers. Every family has to have some lawyers, some accountants, some doctors. Mom sort of made that decision when I was about, 5. She said, we need some doctors. So we've got the other stuff covered, so you're going to be a doctor. I said, okay. And then it worked out, so that was fine. I went to medical school in New York. I did my residency in Connecticut at Yale. I had previously gone to college in Baltimore, so I was mid-Atlantic, Northeast, the whole way through. I'm an East Coaster, New York area, and I was there in academic practice for about 7 years. I also had a real interest in business, and I actually got my MBA, and I do some business work on the side. And then I subsequently moved out to California. I chose my specialty because of the detail that's involved in the work. All surgeons love anatomy. At a certain level, we love the technical aspect of it, and the anatomy of the head and neck is spectacular. The detail is beautiful. It's very, very fine and delicate. It impacts how you look, how you perceive yourself, and I have been on the wrong end of the knife a few times in my life, and to make someone else's suffering less, that makes it worth it. But there is a humanity when you connect with somebody else that is meaningful. If someone teaches you a little, you can manage yourself for a very long time. So I would much rather have a conversation with you and teach so that you understand what you can best do. And once you get that part, we're add-ons, we're helpers. You can manage your own care pretty well. Having the family involved is incredibly important. It can make or break someone's care because it changes how they look at things. Sometimes they're an extra set of ears to hear something that you may have missed because you're scared or in pain or just getting a little overwhelmed with information. You know, all the things I tell patients not to do, those are probably the things I do. I stress and I just sit there and I stew. I'm sure I should meditate. Yeah, I need to work on that. It works better for patients if we are all working as a team, on the provider side, hospitals, all of that. And I have one patient in particular that I remember who had a laryngeal cancer, a cancer of the throat. And he was terrified. He was terrified. He had the surgery, and he couldn't have been happier. He was a different human being. And it was such a profoundly happy-making experience for me to see the difference in him. That was satisfying.